Sheriff's Office. My name is Stewart. I run the Detention Center for the Sheriff. I've been in that capacity since 2011. I'm here to talk today. Our Sheriff's Office deals with mental illness on a lot of different capacities, and I'm just here to speak about the Detention Center today. We can talk about the involuntary commitment process, dealing with the mentally ill as we respond to calls, but I'm mainly going to focus on the Detention Center today. First of all, I want to thank the League of Women Voters. Thank you. This is very informative meeting. Appreciate it. Thanks for the invite. And second, I want to thank our sheriff for allowing me to speak. It takes a lot of confidence in me for the sheriff to allow me to speak in a public setting like this. I'm just So he's sitting here with his pistol pointed at me, making sure I say all the right things, so I'm going to try to do that tonight. When I was asked to participate in the forum, I was asked to basically talk a little bit about how many of our inmates are on psychotropic drugs, what those drugs may be, current efforts to deal with those inmates that are on those psychotropic drugs, and what we're doing about the situation. I'm very excited with what our detention center is doing. We have a lot of support from not only the community, the sheriff, our commissioners, to allow us to do some great things, and I'm going to share those tonight. But today, as of 2 o'clock, we had 51 inmates in our facility. 26 of those inmates were on some type of medications. 13 of those inmates out of the 26 were on psychotropic medications. So if you take that 51, half of them were on some kind of meds, then you half that again and they're on psychotropic meds. So we as a detention center are faced with, how do we combat this? How do we recognize this? How do we get these folks on the medications and keep them in a stable environment until they're either, one, sent to a state-run facility, or number two, released from our detention center? Pain, anxiety, depression, sleeplessness, remorsefulness. I'm happy to announce that 100% of our inmates at the Macon County Jail have those problems. And we're blessed that they do, because that proves that they have a conscience, that they're human beings. There's somebody's son or daughter that's incarcerated in our facility, and we try to portray that to them, that yes, you have committed a crime, you've not been found guilty of it yet, you're still somebody's son or daughter in our community. We're going to try to make this as painless as possible. So if you take those symptoms and combine two of those or more, if you go to 99% of doctors' offices in America, they're going to hand you some type of prescription for psychotropic medication. 100% of our people have those. 100%. So how do we differentiate between who we need to get medication for and what treatment is out there that can hopefully combat this and keep these people off of psychotropic medications? In 2008, Sheriff Holland was a part of this. I know several members of our community was involved in the building of the Second Chance program. I know that around 90% of inmates were questioned through a questionnaire of, do you have substance abuse, alcoholism, mental illness? And then out of those 90 inmates that were questioned, there was around 200 kids whose parents were inmates. So how does that impact our future? How do we move ahead? We have 200 parents, or 90 parents of 200 kids in our detention center. So we feel that we owe it to them to have some type of program, something informational to do while they're incarcerated. This Second Chance program was our first meeting in the detention center was in May of 2008. Mike Knighting and Francis
Ventus Singway.
I would butcher that name, I promise you.
Ventus 25.
But yeah, we just know him as Francis in the jail today. I said, what's Francis's last name? We had to call around and get it. Candace, thank goodness, provided it to us. But that Second Chance program provides so much more than counseling. It provides a place to go for resources that are in our community, whether it be housing, other entities, other support group meetings. And the commissioners felt that it was appropriate to fund such a Second Chance program and have continued to fund it. So as we talk a little bit about, we have people on psychotropic medications. I've identified that 100% of our inmates have those symptoms. So we differentiate by asking a battery of questions when they're first brought into our detention facility. Through those questions, we determine what a good starting point for this inmate would be. One of the unfortunate circumstances is that we place them on suicide watch. State mandated questions: do you feel like committing suicide? Have you ever committed suicide? Attempted suicide? Those mandated questions that we're looking for specific data. Also asking medical questions. What kind of medications are you taking? How much alcohol do you drink? As we previously discussed, if you have alcohol or narcotics abuse, more than likely there's something coupled with it. There's an underlying symptom of what's going on. And so we're trying to capture those questions, those answers, and make an informative decision on how we're going to first classify, house this individual, and second of all, how we're going to meet this person's medical or mental health needs while they're in custody. Reports are generated every day. We're sending them to a lot of the members of our crisis intervention team here in Macon County. We're wanting to try to get the information of the inmates, the names of the inmates, to these service providers so that they can have continuity of care when we're talking about these inmates. We have Billy Joe in jail. We know that he's been coming to the NAMI meetings. Make sure that when you come for the NAMI meeting in the jail that I can identify that person. Send them to the appropriate meeting that they need to go to. We have a local doctor that we've contracted with, Dr. Jason Creel. Anytime that we have an inmate that comes in our facility and we think that they may need some medical or mental health care, we will make a recommendation that Dr. Creel sees them. We'd like for the inmate to fill out a sick call request so that we're not violating any of their rights, we're not pushing anything on them. We want the inmate to request help, put in a sick call. Dr. Creel will come see that inmate, determine what medical or mental health needs that he may have. We use a local pharmacy to get our to fill our medications. How am I doing on time? A lot of people, a lot of feedback that I get from the community is, my son is on Celexa and he was arrested. He needs that Celexa very bad. I totally agree with you. But I can't write a prescription for Celexa. Dr. Creel has. And I always try to give them feedback. If you'll bring me those medications while we're going through this process, while we're trying to get your son or daughter's prescriptions filled, when we verify that, yes, that's what's in this prescription bottle, we'll go ahead and try to start that individual on that while we're getting them set up on their own medications. Once we do that, we'll fill the prescription. The pharmacy packs them all in little blister packs so we can track it. We'll give the medications back. Say, here, we want your loved one to have these when they get out of the facility. We don't want him to have nothing. Once an inmate is released from our custody and they do have psychotropic medications or medications, general medical medications, we try to send them out with at least 7 days so they can get in, see a doctor, get this prescription refilled. Some of the most common psychotropic medications that we have, that we utilize, Dr. Creel utilizes, is Celexa, Klonopin, Seroquel, Risperdal, Trazodone. All of those medications can be used, especially Klonopin. You know, Klonopin can be used for depression as also a medium for alcohol abuse, coming straight off of alcoholism. Writing them a prescription for Klonopin will help them with that transition to sober up. You know, an alcoholic that drinks alcohol every day for 20 years all of a sudden comes to an environment where he can't have any. That can be a death sentence. So we try to identify those needs and help that inmate through as fast as we can. Now on to the exciting part.
In 3 minutes.
Perfect. The exciting part is that we have taken a conscious approach to bringing as many resources as we can into our detention center. NAMI has started since February. At one time, I think we were the only jail in North Carolina that was allowing. We still are. The only jail in the state of North Carolina that allows NAMI to come in.
You're really pushing it in Macon County, though.
Well, we want to hang out as long as we can. But we're the only detention center in the state of North Carolina so far that has allowed NAMI to come in. And I think that's a huge step for the whole community. We've contracted with Sarah Altman. She comes in and does some of our one-on-one assessments of people's mental conditions. Works closely with Dr. Creel. NAMI Second Chance. Huge part of our success story. AA, NA. We have a religious chaplain, Mary Ann Thompson. She does a wonderful job. We're working to bring Macon County DSS adult services into our little group. We meet, we try to meet once a quarter, maybe sooner than that, to get all of these services together. And like Smokey talked about, wouldn't it be nice if we could all communicate with each other? Who the chaplain sees and who NAMI sees, and to be able to capture some of those success stories. Yes, they were a Macon County inmate. They got out of jail. They went to NAMI meetings. They went to some of these AA meetings out in our community. To be able to capture those and tell those stories. We hear about gloom and doom of our jails and this and that. Well, we at Macon County, we want to capture the good stuff and let the community know about the good stuff that these people are doing at this time. Thank you for your time. I appreciate it. I hope it wasn't too mumble jumble.
Thank you.